This is going to be an amazing tutorial. Botox and the effects that you need to know about this procedure. As we age, fine lines and wrinkles become etched into the skin. Dynamic wrinkles are one of the telltale signs of the natural aging process and occurs over time as a result of repeated use of your facial muscles. When you make a facial expression such as smiling or furrows or your eyebrows, fine lines, increases appear in the form of a smile line, framing the mouth, the crow's feet around your eyes, or a frown across your forehead. In youth, these fine lines disappear as soon as you stop making that expression. But yes, as you age, these dynamic wrinkles stay visible even when your face is at rest. The appearance of fine lines can be one of the very distressing signs of aging and have many people asking how to smooth out these wrinkles. And I will give you some pointers of what to do instead of taking Botox. However, some people just grab the easiest and the fastest way to smooth out these wrinkles, and that is Botox. So very quickly, if this is your first time on my channel, my name is Maria and welcome to Aglaia Aesthetics Online. I am an esthetician, so I have my hands on. I am an instructor, so I teach. I am an examiner of this industry for many, many years. I train and I love training. So if you want to become an esthetician, link with me. Give me comments below. Love to connect with you. So let's get started in understanding the pros and cons of Botox. So how does Botox work on the wrinkles? Botox is a neurotoxin that affects the nerve. When Botox is injected into a specific area of your face, it blocks the communication between the nerve and the muscle. As a result, the affected muscle cannot contract. This helps smooth out the wrinkles and prevent new ones from forming. Like any drug though, the potential for side effects cannot be completely overruled. Some minor side effects have been reported following Botox may include nausea, allergic reaction to the substance, reaction of facial tightness, dry mouth, sore throat, and flu-like symptoms, just to mention some. If these symptoms persist or worsen, you may need to seek medical attention as soon as possible. Some studies have shown that prolonged use of Botox may lead to muscle atrophy and appearance of new wrinkles. So what is it? Does it take away the wrinkles? Does it make more wrinkles? Well, stay tuned so I can give you all the information. Botox has also been reported as addictive, especially if started at an early age. It is generally advised that Botox for cosmetic purposes should not be given to pregnant women, as the benefit does not outweigh the risk. So now I'm going to give you 9 side effects to know about that I am aware. There might be more. Botox is generally well tolerated, and I mentioned some of the side effects just before. And most people recover quickly after each treatment. However, there are more side effects that you need to be more aware before, or even if you already have had this treatment, so that you decide if you want to continue with this procedure. Number 1, injection site reaction. So you might have pain, bruising, and the skin color changes around the injection site are the most common side effects of Botox. This reaction usually happens if a blood vessel was temporarily injured by the injection. Number 2, headaches are another common Botox side effect. This may be because the medication can cause your muscle to spasm before they're paralyzed, but it isn't fully clear why this happens. The good news is that the headaches are not usually serious and they clear up after a couple of days. Number 3, forehead side effects. So when they do Botox on the forehead, a droopy eyelid called blepharoptosis is one of a common side effects. It's reported to affect up to 20% of people who receive Botox treatments on the forehead. A droopy eyebrow known as subrowtosis is also possible, and they should return to normal within 3 to 6 weeks. However, it may take up to 3 months. Wow. I personally have seen the Mephisto sign. It's another forehead side effect of Botox injection into the frontalis muscle, which is this one here, whereby the outer end of the eyebrow is located above the inner end, possibly producing an intimidating impression. It is also referred to as a quizzical look, the Spock eyebrow, and a sinister look, or the Joker's face. Another temporary, the effect may last up to 3 months. Forehead Botox treatment can also exaggerate wrinkles. This happens when a strong border is created between the paralyzed muscle and the non-paralyzed muscle in the forehead. Number 4, dry skin and flaky skin can happen to some people around the area of their Botox injection. Although the cause isn't completely clear, this appears to happen because Botox lowers the body's ability to make sweat. This can make the skin drier and flakier, and it feels tight in the area. Now, this one here is a little bit scary. Number 5, difficulty swallowing or breathing. Oh my goodness. Botox can weaken the muscles that helps control swallowing and breathing in the mouth, throat, and neck. This can be dangerous for people who already have problems in swallowing or breathing. Although these symptoms are uncommon, they can also appear hours, 2 weeks after the Botox treatment session. So please be aware. Now, the next one is number 6 is eye and vision problems. If you have your Botox injection close to your eye, you may experience droopiness of the eyelid due to the Botox migration to that area. If this occurs, it could last until the effects of the injection wears off, about 3 to 6 months. You might need to live with it. Botox can affect the muscles that control your eyelid, the moving lid, so you might blink less after your injection, so you cannot blink as often. This can result in problems such as dry eye irritation, or eye damage. Chronically dry eyes can lead to scratched cornea. Number 7, administration around the lips also poses a great risk. If incorrectly administered, the drug could paralyze the muscles in the lips, leading to inability to move lips and consequently inability to carry out some essential functions, such as speaking coherently or do this. As you can see, I don't have Botox. I will not have Botox. I just don't believe in Botox. Number 8. Now this one here is also another concern that you need to know. Heart problems, rarely, but Botox can affect your heart. It has potential to cause heart rhythm problems or even heart attack. This can be more likely if you already have heart problems. Number 9, nerve or muscle problems. Yeah, because Botox injection can cause muscle weakness. People who already have nerve or muscle related problems should be very careful. Botox could make your condition worse. Botox side effects are usually temporary, but in rare cases, people who receive frequent Botox injections over a long period of time can have permanent changes to the face. Now, these permanent changes we have seen on people that we know, celebrities, that their faces have changed, that they don't look the same. Now, aging process, yes, the face does change, but they look plastic. There's something wrong, like they cannot talk anymore. Everything looks swollen. So we know that these treatments can cause changes, permanent changes to your face. These can include changes in the person's facial expressions or being unable to make certain facial movements. Can Botox permanently weaken the muscle or muscles? In the long run, this can cause people to experience loss of muscle control and also decrease of strength in the muscle area, which has been injected frequently with Botox. Over time, repeated injections of Botox to a particular area in the body can also cause permanent paralysis of that muscle. My concern is not really much with individuals that are older, 50 or 60, because you are older. My concerns are for the individuals that are young, in their 20s, that they want to prevent to get wrinkles. So they're using Botox to slow down the aging process. However, Botox might make the skin visibly thinner. This might mean exposure of subdermal veins between the areas of normal thickness. Patients who start Botox too early, like in the early 20s, can be at risk for this side effect. In these cases, the skin of the forehead can get prematurely thinner and the muscles weakened. Sometimes after many years of use, this can even result in the look of heavier brows and eyelids. If you are considering Botox treatments, it's important to work with a licensed and experienced healthcare professional. Working with someone who is not licensed may be more affordable or convenient, but doing so can increase your risk of complications. Remember that toxins last 3 to 6 months, and you'll likely need to return for multiple treatments. The average Botox treatment price ranges from $350 to $500 on each area injected, and you need to do it every 3 to 6 months. Botox injections costs can vary greatly according to the region and the doctor who performs the procedure. As with any procedure, side effects are possible. Talk with your doctor about what you can expect during the injection process, during the service, and in the subsequent recovery period. In my next tutorial, I will be talking next week about the alternative things that you can do instead of doing Botox. Let me know below if you have any further questions. If you have not subscribed yet, please consider it. Give me a like, click on the notification bell so you will not miss any of my educational tutorials. And do check on this tutorial on facial muscle exercising that you need to do so you don't have to use Botox. I hope that you found this tutorial to be useful and to bring awareness and walk away with simple and easy tips on what to do. Remember to treat yourself and your skin with love and respect. Until the next time, take care.